Hello and welcome to all. Namaste. My name is Dr. Sudhir and I work as a pain management specialist in Hariom Specialty Healthcare Center, Tirupati. I have done my MBBS Diploma Anesthesia and DNB Anesthesia and fellowship in pain medicine and pain management in cancer patients. As you can see here, the contact details, mobile numbers have been given, location in Tirupati has been shared, website, and my personal email ID has been given. You can mail me regarding the issues you want to discuss about, and I will reply back to you. And let's stay in touch in that way. Video consultation through various formats. Through WhatsApp, if you want to connect, the second number is my number, so that we can do video consultations through that also, and other formats also we can do. And social media, we are present in all the major social media, and in YouTube you can see all the videos, important videos being uploaded. Please have a look at it, and for further knowledge enhancement, and for everyone to improve their knowledge regarding pain management. And in Telegram also, Pinterest also, and Snapchat also, we are there. Okay, fine. Let's go ahead with the next type of pain management. It is pretty much important these days. It has become important these days because its effectiveness has been seen in chronic pain and patients who are suffering more of empathy type of treatment. This is behavior health approaches. See, because of chronic pain, there will be lot of changes which happen in a patient's behavior, his approach to general life, and he himself, gets into a lantern and becomes a person on his own. He doesn't open up, and he feels. I mean, there are suicides which are happening because of chronic pain and acute pain or acute flare-ups of pain. Now, under psychological approach, we have different type of things. Now, let's go one by one. Behavior health approaches. It is important that the relationship between the pain and psychological health. Psychological factors can affect treatment adherence, pain chronicity, and disability status. Chronic pain has got increased risk for psychological distress, maladaptive coping, and physical inactivity related to re-injury. Patients who have chronic pain also have tend to have more of disabilities. Say for example, stroke, hypertension, diabetes, kidney failure. All these things have been found in many patients to develop after they have chronic pain because of various other disorders. And high impact of chronic pain has been shown to affect patients' life and their relationships, work, physical activity, sleep, self-care, self-esteem. See, this is where the behavioral therapy plays a major role, and it's a part of pain management, as a part of biopsychosocial model. Psychosocial part is where it has got its important role, and it has become a multidisciplinary pain management part actually. And behavioral therapy for pain. In behavioral therapy, we focus on applying the principles of operant conditioning to identify and reduce maladaptant pain behaviors and increase adaptive behaviors. Okay. Uh, this is achieved by decreasing reinforcement of maladaptive behaviors in the patient and providing reinforcement behaviors, and reduce avoidance behaviors through gradual exposure to the fear-provoking stimuli which is there in the patient and has been with the patient for a long time. The fear-provoking stimuli is the one which causes this maladaptive behaviors, and it is more cost effective also, and decreases the consumption of the total amount of drugs in the patient, and increases the physical activity of the patient, increases the lifestyle of the patient. Now, next is cognitive behavioral therapy, very famous now, and pretty much ongoing trend. It reduces maladaptive behavior and improves overall functioning. Here, cognitive behavioral therapy, CBT, otherwise called as, it focuses on altering behavioral responses to pain. Altering behavioral response, okay? It also focuses on shifting cognition and improving pain coping skills. Now, cognition is the way in which it is taken. Anything is taken by a person. So, pain coping skills are improved, and it includes psychoeducation about the relationship between psychological factors, that is a person's feelings, thought processes, approach, and pain. Okay, and it is effective in almost many chronic conditions, and the Agency for Healthcare Research and Quality has found that it has got long-term impact in decreasing low back pain and fibromyalgia. Now, next type of therapy is under behavioral therapy is acceptance and commitment. Now, this emphasizes observing and accepting thoughts and feelings. Okay, it uh, provides an input into the patient to live in the present moment and behaving in a manner that serves individual chosen values. Unlike traditional CBT, which is this which I was discussing about, modern CBT approaches or ACT approaches, modern CBT approach is nothing but ACT approaches on creating psychological flexibility through acceptance of psychological and physical experience. CBT is more of maladaptive, changing to adaptive. Here it is acceptance of whatever the patient has. And now, after those two, CBT and ACT, now comes mindful meditation. This is a mind body treatment uh, delivered in a group format. Group of patients will be there. They are all sitting together, and the healthcare provider will provide insight into mindful meditation. It improves patients awareness and acceptance. It's kind of the effect which we see here is a combination of CBT and ACT. Okay, patient undergoes intensive training and for mindful meditation. It helps it to self-regulate their pain and pain-related comorbidities by developing non-judgmental awareness. The word is important: non-judgmental awareness and acceptance of present moment sensations and emotions and thoughts. Okay, now mindfulness based stress reduction. Okay, to decrease the stress, mindfulness, how it is used, it is very effective in rheumatoid arthritis patient, low back pain patient, and multiple sclerosis patient, and it is also found to have positive impact on pain intensity, sleep quality, fatigue, and overall physical functioning and well-being. Now, all these are the important maladaptive behaviors which occur in a chronic patient, and by MBSR technique this has been for all these changes. If not all this, some at least will change, and that changes the perspective of the treatment, quality of the treatment, medications, total medications required, dependence on opioids, all these things, side effects of the drugs, everything will change. And emotional awareness and expression therapy is there. Here the patient is taught to understand their pain, that their pain is exacerbated or maintained by unresolved emotional experiences that influences neural pathway. Here they are made to understand more of scientific part of the pain, and they are made to accept it. They are made to become aware of these unresolved experiences and thus gain control over pain. Then is self-regulatory or a psycho-physiological approach. This again is a mind-body connection. It entails biofeedback approach. It contains biofeedback, relaxation training, and hypnotherapy. Okay, these are the three things. In biofeedback approach, monitoring the patient's real-time feedback for pain, example heart rate, muscle tension, and skin conductance, has is what is used, and then treatment is given. It is very effective for chronic headaches, migraine in adults and children also. Now relaxation training and hypnotherapy, uh, here empirical support is being given, and evidence has been found for hypnotherapy to be uh, effective in cancer pain patient, low back patient, arthritis, pain from sickle cell disease, fibromyalgia. This is what is very important for us: fibromyalgia, chronic fatigue syndromes, cancer pain patients. This is where hypnotherapy plays a role. Still, research has to provide enough evidence. Okay. Now, access to this is what is the important part. Talking about it is very easy, but access to this, now that's why telehealth comes into role through mobile phones or through laptops also. Psychologist is made to talk, or the behavioral therapy doctor is made to speak to the patient, and it has been found that it is as effective as a direct approach. Okay. And access to same thing, access to psychological interventions